This video is on how to manage drug and alcohol cravings in recovery. Keep in mind there are many suggestions on how to deal with them. It is important for you to recognize that experiencing some cravings is normal and quite common. Cravings does not mean something is wrong or that a person really wants to resume active using. Thoughts of relapse are common, especially in the beginning, especially the first 90 days. Of course, they can happen for a lifetime. But one of the scariest things about cravings is that they can appear out of nowhere. Things may be going well for the individual in recovery, but the urge to drink or use drugs pops up in their head. If an individual is having regular cravings, it's not a good idea to ignore it. This could be a sign that something is wrong or there's a wrong turn happening in one's recovery. It is important to realize that just because the individual has cravings does not necessarily mean that they are getting ready to use. I'm going to discuss 3 helpful tools that can help with cravings. The first is called the 4 Ds. The 4 Ds is a set of tools that will help you quickly respond to the majority of urges you encounter in a healthy way. Memorize the 4 Ds and use them when needed. The first of the 4 Ds is delay. Since cravings rise and fall like waves, if you delay a relapse decision for 15 minutes or so, the cravings will most likely dissipate on their own. Number 2 is drink water. Yes, drink a glass of water. It will relax you and gives you a sense of purpose that can derail the cravings. Deep breathing. Deep breathing exercises help maintain calm and focus when cravings are hit, keeping you from making rash decisions. And the 4th one is distract. Get up and move around. Change what you're doing. The craving will pass more quickly if you do. The next helpful craving tool is called DEADS, D-E-A-D-S. It's part of Smart Recovery's 4-point program. Some of you may find yourselves in situations where drugs and alcohol use is taking place, such as a bar, a club, a party, or a social event. Sometimes these cravings sneak up on you when you least expect it, like watching TV or even having flashbacks to when you were using. The first part of this is D, delay using. When a craving has not gone away in several minutes, the temptation is still present. Next, E, escape. Leave the situation, whether it's a bar or a party or even switching channels on your TV. Leaving the scene where temptation strikes always alleviates the pull of using again. Next is A, accept. Acknowledge that you are having a craving and move on. Do not dwell on it. Followed by D, dispute. Eliminate the craving through a rational response. Think about how you'll feel the next day to get an idea of how the aftermath of a craving could turn out. And last is substitute. Replace the craving with something else, such as a brisk walk, a creative activity such as painting, jewelry, hobbies, run an errand or 2, or even leave the room. A change in your environment makes a significant difference. The last craving tool is most likely the best one. Unfortunately, it was not available to those people in recovery 20 or so years ago, but is in full use today by almost everyone. It is the cell phone, a great way to call your sponsor, a friend, a family member, or anyone else that you deem as helpful. Talking to someone is the most highly effective way of dealing with cravings. Thank you for watching, and please visit my website for more recovery videos at www.drivethroughtherapy.com.